It's Wednesday, the 22nd of April. It's our COVID vlog number 6. My name's Steve Mowle and I'm with Martin Marshall, Chair of the RCGP. And today we're talking about the impact of the COVID crisis on non-COVID illnesses, non-COVID diseases and activities. Martin, why is this becoming such an important issue to us GPs?
Well, it's a massive issue. If we take ourselves back to the second or third week in March, which feels like an age ago, I have to say, when the crisis broke, it was very clear that what we had to do was focus on COVID and COVID-related matters. But in doing so, we were also very aware that that had unintended consequences. We know from previous pandemics that when you focus on one condition, then the morbidity and mortality from other conditions goes up as well. We saw that with the swine flu crisis in 2009, when we saw excess cardiovascular deaths. We saw it with the Ebola crisis in 2014, when more people died of TB and AIDS than might have died otherwise, and we saw a reduction in immunisation rates. So during these crises, we know that this happens, and we also know from data that's currently being produced, particularly by ONS, by the Office for National Statistics, that there is a higher than expected mortality level. We don't at the moment know how much of that is related to unrecorded or unrecognised COVID and how much is related to non-COVID conditions, but we know the rising mortality is a real issue.
Okay, so Martin, what do you think are the actual main areas of concern with non-COVID disease?
Well, there's a number of areas that we've highlighted as a college, which I think are really important. So the first one is the presentation of acute problems that look like it could be COVID, but actually isn't COVID. And that's something that as GPs, of course, we're really anxious about. So the child presents with a fever, but might have meningitis, the adult with acute pyelonephritis. Those kind of conditions are ones that we're really focused on. That's really important. We also know that people who've got long-term conditions that are poorly controlled or unstable are people who are a potential issue for us, and we're focusing hard on those. We know that people who present with symptoms that might be cancer, that's also an issue as well, because our referral threshold is altered as a consequence of this crisis. And then finally, there's the preventative issues. And here we're talking particularly about immunisations, and particularly about childhood immunisations. It would be a disaster for everybody if as a consequence of one epidemic, we end up with other epidemics of preventable disease because children aren't being immunised.
So what do you think the root cause of this problem is?
I think as ever, it's multifactorial. I suspect there probably is a large element of if you like, patient demand. We know that patients are being very respectful of the NHS. They're wanting to protect it. So often they're not coming in with problems that they might have come up with outside the crisis. And we also know that patients are anxious about accessing health facilities, both general practice and hospitals, for fear of picking up the virus. So that's one issue. But I think it also influences our decision-making process, and that's something that we have to be careful about. And of course, there's a reduction in hospital services as well that we can refer to for the various conditions that we're referring to. So I think it's multifactorial.
And so what are we doing as a college about it, Martin?
Well, we're doing a number of things. First and foremost, we're presenting a very strong message that general practice is open for business. You know, as GPs, we're playing a core role in this COVID crisis, not only in dealing with COVID problems, but in dealing with these non-COVID problems, which don't go away as a consequence of what's going on. And of course, we're also doing our service redesign work as well. So I think we're doing a lot of work about clarifying with the public through our media work and through our communications through government and other bodies that general practice is open for business, even if the front door might be shut and there might be different forms of access. So that, I think that's really important. We're also working with other organisations like NHS 111 to make sure that they understand differential diagnosis of symptoms that might look like COVID. We're working with government bodies across all 4 nations to make sure that they reopen hospital services as quickly as possible. And I'm pleased to see in most countries and in most services that's happening right now. So I think there's a range of different things that we're doing in order to make sure those services are available.
Well, it's great to see how general practice is responding so proactively.
Yeah, absolutely. And that's what we're here for, isn't it? You know, we are here to keep the NHS running, to keep providing business as usual, albeit in different ways. That's what general practice does so well. And I think all practices should be congratulated for the amazing efforts that they're making in keeping things up and running.
Thanks, Martin. Thanks for everything you're doing. Until our next vlog, do be careful and stay safe out there.